Welcome to Stronger at Home. In this video, we are going to talk about strength training with chronic pain. Specifically, we are talking about chronic pain as a symptom from a known chronic or long-term health condition, like arthritis or chronic non-specific low back pain. These two health conditions are some of the most common causes of pain and disability. Now, pain itself is a complex, unpleasant, sensory and emotional experience. It is subjective and personal to you. Therefore, the same health condition can trigger completely different pain experiences in different people. One of the problems with experiencing chronic pain is that it tends to cause excessive sedentary behavior. Sedentary behavior has been associated with the development of further muscle, bone, and joint weakness, joint stiffness, physical inactivity, poor physical functioning, unhealthy body composition, cognitive impairment, and an overall decreased quality of life. Once an acute or end-stage condition has been ruled out, current guidelines emphasize becoming and remaining as active as possible. And this includes participating in strength training. We also want to avoid excessive bed rest. For most chronic health conditions, evidence suggests that strength training does not cause a worsening of symptoms or an acceleration of disease progression. In fact, there is much to be gained from incorporating strength training into your lifestyle. There may be initial soreness when doing any exercise for the first time in a long time, but in the long term, strength training may help with pain through a number of different pathways, physiologically, socially, and cognitively. However, since chronic pain experience is highly individualized, you may have to experiment with exercises, positions, and equipment types that work best for you. In strength training, there is no one exercise that you must do. In addition, most exercises can be done from a number of different body positions, such as standing, seated, or lying. We can find creative ways to add load if handheld weight is uncomfortable or painful, like using wrist or ankle weights or putting on a weighted backpack. We'll want to work towards a full range of motion, but again, we can start with a range of motion that feels most comfortable and increase as our tolerance increases. There is also no intensity that we must start at, so we absolutely can start at a low intensity and progress slowly. We may have to find creative ways to find exercises, positions, range of motions, and intensities that we're able to tolerate with little pain. But incorporating structured, progressive strength training will help to increase our strength and endurance for other activities of daily living. Strength training participation will also help to increase our pain tolerance, decrease stiffness, slow the deconditioning process, and even may help to protect against painful recurrences.